Hello everyone, and welcome to this case study that I will be doing for my SPCE 683 course here at Ball State University. My name is Leilani Rittenhouse. I am 25 years old and have been working within the ABA field for over a year and a half now. I currently reside in Muncie, Indiana, and work within a local clinic in the state of Indiana as a registered behavior technician. I provide services to learners ages 2 to 10 years of age at this local clinic, and am currently finishing my master's degree within applied behavioral analysis here at Ball State University, and will be finishing this semester. Going over the overview of this study. So within this presentation, I will be going over a brief description of the client that I have chosen to assess for this case study. I will be discussing this client's behaviors, the function of the behavior, any assessment tools and procedures that regard this client, as well as discussing the rationale as to why these assessments and tools are being utilized and how the results are relevant to the designated BCBA task list. So as we go over the summary of the client, we will be referring to this client as Client B. They are 2 years of age and diagnosed with autism spectrum disorder. This client is an energetic and active 2-year-old boy who prefers cars from his favorite movie, foam tiles, Sesame Street books as his main forms of reinforcement. This client is presented as an early learner for early intervention, and Client B displays certain specific skill deficits that are focused on social skills, communication skills, and fine motor skills. The behaviors that are targeted for concern is that Client B engages in mouthing, tantrums, self-injurious behavior, aggression, throwing objects, and elopement. So for his particular age group, we utilize VB map assessments for his programs for Client B. The VB map assessment was utilized to assess language and learn social skills. It was based on B.F. Skinner's 1957 analysis of verbal behavior, as well as the 170 milestones in field test data that was typical within overall developing children. With the VB map assessment, there are, again, 170 milestones with 900 skills in 16 different skill areas that include manned, echoic, tact, listener motor imitation, independent play, social play, verbal perception match to sample, linguistic structure, group, as well as classroom skills. And this is a direct measure through pre-assessments, testing, and observations with the client. With VB map assessments, there are 5 different assessments within the VB map. There is the milestone assessment, the barriers assessment, the transition assessment, task analysis and skills tracking, as well as placement and IEP goals that we look over with Client B, as well as other learners within our facility. The overall rationale for this assessment is that the reasoning behind this decision to overall utilize this assessment, the caregivers and staff expressed several concerns that were related to verbal and social skills, as well as the rising problem behaviors within the client. Client B's language, albeit he is 2 years old, is still overall developing within those functional communication skills, as well as social play and gross and fine motor skills. This VB map was utilized via checklists to assess and continue tracking the progress and process of their language or vocalization, as well as their target behaviors. So we also utilized a functional assessment of problem behavior, or an FBA, and this assessment was used on the behaviors for concerns to determine functions of the behavior and why they occur. This information was then utilized to confirm any other functions of the behavior that was also occurring alongside these target behaviors. My hypothesis, or our hypothesis for this regarding interviews, are direct observation and data analysis, indicates that client B engages in their behaviors for concerns to gain attention and access to tangibles, as well as escape for his tantrums, self-interest behavior, aggression, and throwing objects. He engages also in mouthing behavior for automatic sensory, or just his sensory. With that, we can go over the task list assessment. So after the completion of this assessment with this client, I was able to link the overall results to the task list. During the procedures of the assessment, I was able to measure, display, and interpret the data being collected. So the first task that was utilized was measuring dimensions of behavior, which is C-4. C-8 was also used with evaluating the validity and the reliability of the measurement being used within the session or the overall assessments. F4 we also utilize to conduct assessments of relevant skill strengths and deficits within the client. F6, that describes the common functions of the problem behavior. F8, which conducts functional analysis of the problem behavior. And F9, which how we interpreted functional assessment data afterwards. So in conclusion, overall the results after the completion of these assessments and incorporating the tasks in the BCBA task list, there is room to conclude or to come to the conclusion that we will be able to conduct a behavior intervention plan, a support plan, and be able to back those current skills and determine if the client's current skills and deficits to conduct a future and effective treatment plan for client B.